ಮಾಡ್ತೀನಿ. ಕೋವಿಡ್ ನ ಮೂರನೇ ಅಲೆಯ ಸಂದರ್ಭದಲ್ಲಿ ಈ ತುರ್ತು ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ ವೈದ್ಯರೊಂದಿಗೆ ನೇರ ಸಂಪರ್ಕವನ್ನು ಇಟ್ಕೊಂಡು ಸಲಹೆ ಸೂಚನೆಗಳನ್ನು ಪಡೆಯುವಂತ ಒಂದು ಉದ್ದೇಶ ಫ್ಯಾಕ್ಟ್ ಇಂಡಿಯಾ ಫೌಂಡೇಶನ್ ಜೊತೆ ಈ ಟೆಲಿ ಕನ್ಸಲ್ಟೇಷನ್ ಮತ್ತು ಹಾಟ್ಲೈನ್ ಸರ್ವಿಸ್ ಮಾಡಿಕೊಳ್ಳುವಂತೆ ನಾವು MOUಗಳನ್ನು ಮಾಡ್ಕೊಂಡಿರ್ತೇವೆ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಇವತ್ತು ಮೂರನೇ ಹಂತದ ತರಬೇತಿಯನ್ನು ನಾವು ಆಯೋಜಿಸ್ತೇವೆ. ಮೈಸೂರು DCPಗಳ ಪ್ರೊಟೆಕ್ಷನ್ ಆಫೀಸರ್, ನಾನ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನಲ್ ಕೇರ್ ಹಾಗೂ ಎಲ್ಲಾ ನೋಂದಾಯಿತ ಮಕ್ಕಳ ಪಾಲನಾ ಸಂಸ್ಥೆಗಳ ಅಧೀಕ್ಷಕರು ಹಾಗೂ ಸಂಯೋಜಕರು ತರಬೇತಿ ನಡೀತಾ ಇದೆ. ಈ ತರಬೇತಿಯಲ್ಲಿ ಸಂಪನ್ಮೂಲ ವ್ಯಕ್ತಿಗಳಾಗಿ ಶ್ರೀ ಶಂಭು ರಮೇಶ್, ಹೆಲ್ತ್ ಪ್ರಮೋಟರ್, ಇನ್ಫಾರ್ಮೇಶನ್ ಎಜುಕೇಶನ್ ಕಮ್ಯುನಿಕೇಶನ್ ಆಫೀಸರ್, COVID-19 ಟೆಲಿಮೆಡಿಸಿನ್ ಪ್ರಾಜೆಕ್ಟ್, MSF ಇಂಡಿಯಾ, ಡಾಕ್ಟರ್ಸ್ ವಿದೌಟ್ ಬೌಂಡರೀಸ್ ಶ್ರೀ ಶಂಭು ರಮೇಶ್ ಅನ್ನೋರು ನಮ್ಮ ಜೊತೆ ರಿಸೋರ್ಸ್ ಪರ್ಸನ್ ಆಗಿ ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ. ಅವರಿಗೆ ನಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಸ್ವಾಗತವನ್ನು ಕೋರ್ತಾ ಇದ್ದಾರೆ. ವೆಲ್ಕಮ್ ಶಂಭು ಸರ್. ಅವ್ರ ಜೊತೆ ಫ್ಯಾಕ್ಟ್ ಇಂಡಿಯಾ ಫೌಂಡೇಶನ್ ಇಂದ ಶ್ರೀ ರೂಬೆನ್ ಡೇನಿಯಲ್ ಅವರು ನಮ್ಮ ಜೊತೆ ಇದ್ದಾರೆ ಆಸ್ ಎ ರಿಸೋರ್ಸ್ ಪರ್ಸನ್. ಸೊ ವಿ ವೆಲ್ಕಮ್ ಯು both of them, Mr. Shambhu Ramesh as well as Ruben Daniel. Welcome you both of you. So ಅದೇ ತರ ಇವತ್ತು ಮೈಸೂರು ವಿಭಾಗದ ಮಕ್ಕಳ ರಕ್ಷಣಾ ಘಟಕದ ರಕ್ಷಣಾಧಿಕಾರಿಗಳು, ಸಾಂಸ್ಥಿಕ ಹಾಗೂ ಎಲ್ಲ ನೋಂದಾಯಿತ ಮಕ್ಕಳ ಪಾಲನಾ ಸಂಸ್ಥೆಗಳ ಸಂಯೋಜಕರು ಮತ್ತು ಅಧೀಕ್ಷಕರು ನಮ್ಮ ಜೊತೆ ಈ ತರಬೇತಿಯಲ್ಲಿ ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ. ದಯವಿಟ್ಟು ನಾವೆಲ್ಲರೂ ಈ ತರಬೇತಿಯನ್ನು ತುಂಬಾ ಗಮನವಿಟ್ಟು ಕೇಳಿ ಮತ್ತು ಇಲ್ಲಿ ಟೆಲಿ ಕನ್ಸಲ್ಟೇಷನ್ ಸಂಬಂಧಪಟ್ಟಂತ ದಯವಿಟ್ಟು ಮ್ಯೂಟ್ ಮಾಡಿ. ಅಲ್ಲಿ ಟೆಲಿ ಕನ್ಸಲ್ಟೇಷನ್ ಸಂಬಂಧಪಟ್ಟಂತಹ ಎಲ್ಲ ಇನ್ಫಾರ್ಮೇಶನ್ಸ್ ಗಳನ್ನು ಸರಿಯಾದ ರೀತಿಯಲ್ಲಿ ತಿಳ್ಕೊಳ್ಬೇಕು ಅಂತ ನಾವು ಈ ಮೂಲಕ ಕೇಳ್ತಾ ಇದ್ದೇವೆ. ಅಂಡ್ ವಿ ಆರ್ ಥ್ಯಾಂಕ್ಫುಲ್ ಟು ಯುನಿಸೆಫ್ ನ ಶ್ರೀ ಹರೀಶ್ ಯೋಗಿ ಅವರು ನಮ್ಗೆ ಆನ್ಲೈನ್ ತರಬೇತಿಗೆ ತಾಂತ್ರಿಕ ಸಹಾಯವನ್ನು ನೀಡಿದ್ದಕ್ಕಾಗಿ. ಇನ್ನೊಂದು ಇನ್ಫಾರ್ಮೇಶನ್, ಚಾಟ್ ಬಾಕ್ಸ್ ನಲ್ಲಿ ನಾವು ಒಂದು ಗೂಗಲ್ ಫಾರ್ಮ್ ಲಿಂಕ್ ಅನ್ನು ಶೇರ್ ಮಾಡಿದ್ದೇವೆ. ದಯವಿಟ್ಟು ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡುವವರು ಎಲ್ಲರೂ ಆ ಗೂಗಲ್ ಫಾರ್ಮ್ ಅನ್ನು ವಿಸಿಟ್ ಮಾಡಿ ಅಲ್ಲಿ ನೀವು ತಮ್ಮ ವಿವರಗಳನ್ನು ನಮೂದಿಸುವ ಮೂಲಕ ನಮ್ಗೆ ಹಾಜರಾತಿಗಳನ್ನು ತಗೊಳ್ಳಿಕ್ಕೆ ಸಹಾಯ ಮಾಡುವಂತ ನಾವು ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೇವೆ. ಅಂಡ್ ಇನ್ನು 1 ಗಂಟೆಗಳ ಕಾಲ ಈ ಟೆಲಿ ಕನ್ಸಲ್ಟೇಷನ್ ಮತ್ತು ಆನ್ಲೈನ್ ಬಗ್ಗೆ ಇನ್ಫಾರ್ಮೇಶನ್ ಅನ್ನು ನಾವೆಲ್ಲರೂ ಗಮನವಿಟ್ಟು ಕೇಳಬೇಕು ಅಂತ ಇನ್ನು ಕೇಳ್ಕೊಳ್ತಾ. ಅಂಡ್ ಓವರ್ ಟು ಯು ರೂಬೆನ್ ಡ್ಯಾನಿಯಲ್. ಅದಿದೆ ಓವರ್ ಟು ಯು ಸರ್. ಥ್ಯಾಂಕ್ ಯು.
ಸೊ ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಈಗ ಇವತ್ತು ದಿನ COVID-19 ಅನ್ನೋದು ಇವಾಗ ಈ ಒಮಿಕ್ರಾನ್ ವೇವ್ ಜಾಸ್ತಿಯಾಗಿ ಬರ್ತಾ ಇದೆ. ಸೊ ಅದನ್ನು ನಾವು ಹೆಂಗೆ ಮ್ಯಾನೇಜ್ ಮಾಡಬೇಕು ಅನ್ನೋ ಟೈಮಲ್ಲಿ ನಮ್ಮ KSICPS ಡೈರೆಕ್ಟರ್ ಮೇಡಮ್ ಪಲ್ಲವಿ ಮೇಡಮ್ ಜೊತೆಗೆ ಒಂದು ಮೇಡ್ ಡಿಸ್ಕಷನ್. ಇದು ಇವಾಗ ನಡೆದಲ್ಲ, ಒಂದು 8-9 ತಿಂಗಳ ಮುಂಚೆನೆ. ಸೊ ಇದನ್ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ಡಿಸ್ಕಷನ್ ಎಲ್ಲ ಮಾಡಿ ಎಲ್ಲ CCIಗಳಿಗೂ ಹೆಂಗೆ ಅದರಲ್ಲಿ ಇರೋ ಮಕ್ಕಳು ಮತ್ತೆ ಮಕ್ಕಳಿಗೂ ಸಹಾಯ ಮಾಡುವ ಕೇರ್ ಗಿವರ್ಸ್, ಬೇಸಿಕಲಿ ರೈಟ್ ಫ್ರಮ್ ದ ಸೂಪರಿಂಟೆಂಡೆಂಟ್ಸ್ ಟಿಲ್ ದ IMS, ಅವ್ರೆಲ್ರಿಗೂ ಕೂಡ ನಾವು ಹೆಂಗೆ ಸಹಾಯ ಮಾಡೋದನ್ನ ಬಗ್ಗೆ ಯೋಜನೆ ಮಾಡಿ ಈ ಹಾಟ್ಲೈನ್ ಮತ್ತೆ ಟೆಲಿ ಕನ್ಸಲ್ಟೇಷನ್ ಸರ್ವಿಸಸ್ ಅನ್ನ ತಗೊಂಡ್ ಬಂದಿದೆ. ಸೊ ಇದು ಯಾಕೆ ಅಂದ್ರೆ ಕೆಲವು ಟೈಮಲ್ಲಿ ಇಮಿಡಿಯೇಟ್ ಡಾಕ್ಟರ್ಸ್ ರೆಸ್ಪಾನ್ಸಸ್ ಸಿಕ್ಕದೇ ಇಲ್ಲ. ಹಾಗಾಗಿ ಈ ತರ ಒಂದು ಟೆಲಿ ಕನ್ಸಲ್ಟೇಷನ್ ಮತ್ತೆ ಒಂದು ಹಾಟ್ಲೈನ್ ನಂಬರ್ ಕೊಟ್ಬಿಟ್ಟು ಅದನ್ನ ಮುಖಾಂತರಂಗ ನಾವು ಡಾಕ್ಟರ್ ಅನ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಬಹುದಾ ಅಂದ್ಬಿಟ್ಟು ಒಂದು ಯೋಜನೆ ಮಾಡಿದ್ವಿ. ಅದೇ ರೀತಿಯಲ್ಲಿ as we are identifying, ನಾವು MSF ಇಂಡಿಯಾ, ದಟ್ ಇಸ್ ಡಾಕ್ಟರ್ಸ್ ವಿತೌಟ್ ಬಾರ್ಡರ್ಸ್ ಅನ್ನುವ ಒಂದು ಗುಂಪನ್ನ ಲಾಸ್ಟ್ ಡಿಸೆಂಬರ್ ಅಲ್ಲಿ ಭೇಟಿ ಮಾಡಿದ್ವಿ. ಅದರ ಆಮೇಲೆ ನಾವು ಅವ್ರ ಜೊತೆಗೆ ಮಾತಾಡಿ ಒಂಚೂರು ಇದನ್ನ ಮಾಡಬಹುದು ಅಂದ್ಬಿಟ್ಟು ನಾವು ಇವಾಗ ಏನಾಗುತ್ತಂದ್ರೆ ನಿಮ್ಮ CCIಗಳಲ್ಲಿ ಮಕ್ಕಳಾಗಿರ್ಬೋದು, ಇಲ್ಲಾದ್ರೆ ಕೇರ್ ಗಿವರ್ಸ್ ಆಗಿರ್ಬೋದು, ಏನಾದ್ರೂ ಸಿಂಪ್ಟಮ್ಸ್, ಕೋವಿಡ್ ಸಿಂಪ್ಟಮ್ಸ್ ಬರುತ್ತಂದ್ರೆ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ನಾವು ಕೆಲವು ಆಕ್ಷನ್ಸ್ ತಗೋಬೇಕಾಗುತ್ತೆ. ಯಾವ್ದಕ್ಕೆ ಅದು ತಗೋಬೇಕು, ಹೆಂಗೆ ತಗೋಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆನೆ ಅವರು ಸಂಭವ್ ರಮೇಶ್ ಸರ್ ಅವರು ಮಾತಾಡ್ತಾರೆ. ಅದೇ ರೀತಿಯಲ್ಲಿ ಈ ತರ ಒಂದು ಫೆಸಿಲಿಟಿಯನ್ನು ನೀವು ಭಾಗವಹಿಸ್ಬೇಕಂದ್ರೆ ಇಲ್ಲಿ ಗೂಗಲ್ ಫಾರ್ಮ್ ಒಂದು ಕಳಿಸಿದ್ದಾರೆ. ದಯವಿಟ್ಟು ಆ ಫಾರ್ಮ್ ಅಲ್ಲಿ ನಿಮ್ಮ ಅಡ್ರೆಸ್ ಮತ್ತೆ ನಿಮ್ಮ ಇಮೇಲ್ ಅಡ್ರೆಸ್ ಎಲ್ಲ ಸ್ವಲ್ಪ ಕಳ್ಸಿಕೊಡ್ತೀರಂದ್ರೆ ನಾವು ನಿಮ್ಗೆ ಅದನ್ನ ಫಾಲೋ ಅಪ್ ಮಾಡೋದಕ್ಕೆ ತಕ್ಕದಂಗ ಒಂದು ಎಕ್ಸೆಲ್ ಶೀಟ್ ಕಳ್ಸಿಕೊಡ್ತೀವಿ. ಸಪೋಸ್ ನೀವು ಇವತ್ತು ಈ ಟೋಲ್ ಫ್ರೀ ನಂಬರ್ ಕಾಲ್ ಮಾಡ್ತೀರಾ, ಯಾರಿಗೂ ಕೋವಿಡ್ ಬಂದಿಲ್ಲ ಅಂದ್ರೆ ಪರಲ್ಲ, ಸಪೋಸ್ ಕೋವಿಡ್ ಬಂದಿದಂದ್ರೆ ಅದನ್ನ ಹೆಂಗೆ ನಾವು ಫಾಲೋ ಅಪ್ ಮಾಡ್ಬೇಕು, ಹೆಂಗೆ ICPS ರಿಪೋರ್ಟ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ನಾವು ನಿಮ್ಗೆ ಒಂದು ಚೂರು ಒಂದು ಫ್ಲೋ ಚಾರ್ಟ್ಗಳ ತರ ನಿಮ್ಗೆ ಕಳ್ಸಿಕೊಡ್ತೀವಿ. ಸೊ ನಾವು ಈ ಟ್ರೈನಿಂಗ್ ಅನ್ನ ಅವರು ಮುಂದೆ ತಗೊಂಡು ಹೋಗೋದಕ್ಕೆ ಐ ಜಸ್ಟ್ ರಿಕ್ವೆಸ್ಟ್ ಸಂಭವ್ ರಮೇಶ್ ಸರ್ ಟು ಗೋ ಅಹೆಡ್ ಅಂಡ್ ಗಿವ್ ದ ಟ್ರೈನಿಂಗ್. ಇವರು ಏನ್ ಕವರ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ ಕೋವಿಡ್ ಹೇಗಿದೆ, ಇವಾಗ ಹೇಗೆ ಅದು ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದೆ, ಅದನ್ನ ಟೈಮಲ್ಲಿ ನೀವು ಹೆಂಗೆ ಕಾಲ್ ಮಾಡ್ಬೋದು, ಹೆಂಗೆ ವಿಡಿಯೋ ಕನ್ಸಲ್ಟೇಷನ್ ಡಾಕ್ಟರ್ ಜೊತೆಗೆ ನರ್ಸಸ್ ಜೊತೆಗೆ ಮಾಡ್ಬೋದು, ಈ ಟೋಲ್ ಫ್ರೀ ನಂಬರ್ ಜೊತೆಗೆ ಹೆಂಗೆ ಮಾಡ್ಬೋದು ಅನ್ನೋದ್ ಬಗ್ಗೆ ಅವರು ನಮ್ಗೆ ಹೇಳ್ಕೊಡ್ತಾರೆ. ಓವರ್ ಟು ಯು ಸಂಭವ್ ಸರ್. ಲಾಸ್ಟ್ ಅಲ್ಲಿ ಸಂಭವ್ ಸರ್ ಒಂದು ಮೇಲ್ ಐಡಿ ಮತ್ತೆ ಫೋನ್ ನಂಬರ್ ಕೂಡ ತೋರಿಸ್ತಾರೆ. ಅದು ತೋರಿಸುವ ಟೈಮಲ್ಲಿ ನೀವು ಅದಕ್ಕೆ ನೀವು ಏನ್ ಮಾಡ್ಬೋದು ಅಂದ್ರೆ ಯು ಕ್ಯಾನ್ ಸೆಂಡ್ ಆಲ್ ಯುವರ್ ಕ್ವರೀಸ್. ನಿಮ್ಗೆ ಏನಾದ್ರೂ ಕ್ವಶನ್ಸ್ ಇದೆ ಅಂದ್ರೆ ಅದಕ್ಕೆ ನೀವು ಮಾಡ್ಬೋದು. ವಿ ವಿಲ್ ಕಲೆಕ್ಟ್ ಯುವರ್ ಕ್ವಶನ್ಸ್ ಅಂಡ್ ರೆಸ್ಪಾಂಡ್ ಟು ಯು ಪರ್ಸನಲಿ ಆಲ್ಸೋ. ಓವರ್ ಟು ಯು ಸಂಭವ್ ಸರ್.
Thank you, Ruben. Thank you for giving me the opportunity. So I'm just sharing my screen. Is it visible? Hello, Ruben. Can you see my screen?
Yes, sir. We can see.
Oh, okay. Okay. So thank you for giving me the opportunity. So today I will be sharing some details about our COVID-19 teleconsultation services and how these services can be utilized for the childcare institutions. So beginning with, we have mainly 3 topics I will be covering. First one is about the COVID-19, which is about the infection and a little bit about the virus and the recent variant Omicron. And the second part will be COVID-19 in children. So if infection has happened to children, what all things we need to look for and how we can manage it in the CCIs. And the last and important part, how to conduct this COVID-19 telemedicine consultation. Okay. So without any further delay, we will. I'm just moving on to the first slide. So as you might all be knowing that from the past 2 years, everyone is discussing about COVID-19. So most of you might be knowing the details which I'm sharing, but still this is please consider this as a recap. So it's an infectious disease, which is a virus disease which is caused by the virus SARS-CoV-2 virus. It is SARS stands for severe acute respiratory syndrome. So basically this virus will be affecting our lungs, our respiratory tract. So it is an airborne and droplet transmission. So that through air and a droplet, that is when we are speaking, when we are coughing, sneezing, especially without any protection, that is mask or any barrier, it will spread from one person to another. Now, another important disease which known to cause through this transmission is tuberculosis. Everyone might be aware about tuberculosis, but this virus infection is more. There is very high chance that this infection can spread to you, much higher than that of tuberculosis. Now, the common symptoms if you get COVID-19 is a fever will be there in 90% of the cases. Then, since it is affecting the respiratory tract, we will be having respiratory symptoms like cough, sore throat, loss of taste and smell, body ache, and etc. And COVID-19 is a pandemic. So a pandemic means it is something which is happening all around the globe. So it is not only in India, it is happening all around the globe. Almost all the countries are suffering from this particular disease. So if you take some other disease like dengue fever or something else like chikungunya and all these things, and even sometimes Ebola also. If you take Ebola, which has happened in uh, African countries, but it didn't cross, it didn't came to India. So it is located in that particular country only. But COVID-19 on the other end, it is spread across all the countries. So it is actually called as a pandemic. Now, India didn't experience the first wave in a much intense manner, but we had a very grave second wave. So there was a spiraling up of cases. Cases were coming day by day on a very high number, and we had a very reduced supply of essential treatments. We had a deficiency of oxygen. We had deficiency of COVID-19 beds in hospitals, etc. And we have seen in young population there were death were more because we have just started our vaccination for the adult, I mean older population. Then so many people who are actually been diagnosed with COVID further causes fungal infections like black fungus disease and white fungus disease, mainly because people were taking a lot of corticosteroid, the steroids, which was actually not necessary. So simply since they were taking in order to reduce symptoms, uh, other problems like fungal infections were causing. So actually all of these problems like the oxygen demand, the bed unavailability, and the eruption of fungal diseases. Everyone could have been prevented if we could have have scaled up our system by setting up an early intervention and treatment. So, but that we were not actually been able to do at that time. And the second wave is actually caused by the Delta version of COVID-19 virus. Um, Now, you might have been seeing in the newspapers, TVs, a new variant of a virus has been, on the run. So, the new variant is called Omicron. So, the World Health Organization declared this particular variant as a variant of concern because the problem with Omicron is it spreads much higher than that of Delta. So, that means we need to reensure that all our proper masking and social distancing norms are in place in order to protect from the Omicron version of COVID-19 virus. And one thing which we have seen is most of the cases are actually mild or asymptomatic. So again, so the preventive options left with us is we need to reassure that everyone is masking properly, and the vulnerable population like elderly population or who are actually suffering from some kind of diseases are being protected. Now, if you look into the chart, I'll just show you a glance of this thing. So this is a study which is conducted in South Africa. So since it is South Africa, they had 4 waves. In India, we had only a third wave, which is actually happening. But there they had 4 waves. So if you look into the chart, you can see the peaks. Okay, so the last one, this one is the peak due to Omicron infection. You can see that even after giving vaccines and all, the caseload is not coming down much. There is a slight decrease, but still the peak is not still the curve is not still peaked up, so it can go further also. So this is what actually we've seen. So the number of cases is still remains higher, but the advantage or the positive side of this is you can see the red line which actually shows the number of deaths. So with each peak, you can see a subsequent increase in the red line. But if you look into the last peak, the red line is not increasing. That means even if there are more number of cases, people are not dying with the diseases, or it is not going into a complication. But these are early symptoms, early studies. We don't know how it is going to end. So the early signs are showing the transmissibility of this virus is very high. This Omicron is very high, but it is not causing any serious complications. Okay. Now, if you see the this picture, you can see the first picture. The first one is the Omicron. You can see how many mutations, how many upgrades the virus has taken, and this below this Omicron virus is the Alpha virus. This is the patent or the parent, the wild virus, the first virus. So from the first virus, almost 32 mutations have been occurred for Omicron virus. So virus is continuously evolving. Okay. So why virus is coming like this? Why virus is upgrading or new variants are coming? One reason is it is a pandemic. So even if in India we control everything, that is not going to benefit, because when people are started coming to India, they will bring the disease, right? Now, pandemic fatigue. I will discuss about what is pandemic fatigue in the next slide. Now, there is a difference in healthcare standards across countries. For example, if you take during the second wave time, the second wave happened in many European countries as well. There were number of cases coming up, but they have their own, their health system is little bit better than ours. So they were able to, manage it with their adequate health care facilities. But in India, we have a lot of people, population is high, and from state to state, if you move across, there can be some problems. If you go especially to northeastern states or northern states, it is not as much as health facilities available like that of the South Indian states. So there is a difference. And vaccine inequity, another important aspect. So we need to protect everyone. In order to ensure everyone is protected, we have to ensure that everyone is being provided with the vaccine. But that is not actually happening. If you take example of African countries and all, they are still, vaccine is not being given. And the COVID virus, the SARS-CoV coronavirus is an RNA virus. RNA virus means the chance of further mutation with the virus is very high. Now, this is called pandemic fatigue. So, pandemic fatigue is an expected and natural response to a prolonged public health crisis, because it's been 2 years. We are actually been suffering from this. It's not 1 month or 2 months. It's been 2 years. So we all are adjusting our lives by wearing masks, by not going out unnecessarily. But all these things are actually not very convenient for us. We are restricting this just because we are actually suffering from something or we are afraid of something. But when time goes, people will excuse me. So people will actually get tired of by following all these things. So that will result in you can see the different pictures where people are not wearing mask properly. They're not cared about wearing mask in a proper manner. So all these things can happen, and you and me, everyone will be like this. I'm not meant to make shame on anyone, but everyone will be doing the same thing because of the pandemic fatigue. Now, when I come to the latest reports, which is released by the Karnataka government, the COVID-19 cases in Karnataka is likely to peak by the last week of this month. That means from almost on the 23rd onwards, the cases are expected to come a little bit higher, and it is likely to peak in the last week of January. So this is what the latest government guideline is telling. So we need to make sure that a very good system is in place just in case any of us are actually been suffering from COVID-19 infection. Now, we will move on to the second part, which is COVID-19 in children. So compared to adults, children will not be getting a serious COVID-19 infection. A very small proportion of the children is actually been getting a serious infection. You can see more than 70% of the children are asymptomatic. That means we are not able to, they did not express any symptoms. They won't be having any symptoms at all for them. But 30% of the people, the children might show some symptoms. And out of this 30%, 1 to 2% of them require a treatment, or sometimes they need to be admitted to ICU. And one of the reason why it is complicating in children is the condition is called multi-system inflammatory syndrome. It is short formed as MIS-C, multi-system inflammatory syndrome in children. So it is MIS-C. So what will happen during this is the children's body will have a total immunologic response that results in a generalized inflammation. So that will cause inflammation in the major organs like heart, lungs, kidneys, brains, etc. And this is actually a serious condition. If any of the children is actually, go into this condition, we need to admit the child into an ICU care facility. Now, how can we early identify this multi-system inflammatory syndrome? So the most common or the most emergency things which we should look for is, did the children is having any breathing troubles, whether the children is troubling or is having is unable to take adequate air through his breathing. So if it is there, that there can be a risk. And if the child is telling that while inhaling, the child is having a persistent pain or pressure on the chest, or the children is having any confusion, because sometimes it is going to affect the brain. So the children will be having confusion like, where is the bathroom? Going to bathroom, suddenly children don't know where is the bathroom. Children forget about himself, his name or her name or something like that. So this kind of confusion can be there. Then inability to wake or stay awake, children will too much drowsy. And the most important thing which you can notice is the children's skin will get pale. So the pale means the color will be, the usual color of the children will be turned into a little bit blue color. So why this color change is happening is, the blue color is because the oxygen level, when the oxygen level in the blood is coming down, we all turns into blue because of the deposition of carbon dioxide. So if you are seeing anywhere a blue discoloration, then that is also very important to note that the children need to be taken immediately, because the children is not getting adequate oxygen and the carbon dioxide, which is actually been building up in the children's body. So that is an emergency condition. Okay. Now, according to the Ministry of Health and Family Welfare, Government of India, it categorizes children into 4 different categories. That is asymptomatic children, mild, moderate, and severe cases. Irrespective of everyone, all the classes, almost all the children, all the people will be having, all the children will be having these common symptoms that include fever, cough, running nose, sore throat, then body ache, etc. So these are the common symptoms. So this is not a or a red flag symptoms. It is very common. It is for everyone, but there are some red flag symptoms, the symptoms which we should look closely onto. That include which I've already told. If any pain or problem has actually been expressed in the chest, or is there any confusion, inability to behave, and seizure, fix if any of the children going into a fix, that is also important to note that the children is in severe conditions. And another important aspects where we can identify early is, I think all the CJ is having pulse oximeter with them, right? So when you measure the pulse oximeter, put the pulse oximeter into the hand of the finger of a children. So if the SpO2 level is coming less than 90 percentage, then it is very, very important that the children is actually into the category of severe, which needs immediate admission to a hospital. Okay, so if you measure the pulse oximeter and the pulse oximeter reads less than 90 percentage, it is a very severe condition, and you need to take the child immediately into the hospital, and don't wait till any telemedicine or any other kind of response has been happening. That is an emergency. Okay, so please note down that. Now, irrespective of the symptoms, some children are inborn complication, serious to some COVID-19 infection because of the genetic disease or genetic makeup or developmental disorders. Okay, so if any of the children who are having suffering from heart disease, kidney disease, liver disease, etc., or the children who is having low immunity because of the treatment of cancer or immune diseases, all these children and especially obese children, so all these people are actually a little bit higher risk of going into serious disease. So please watch closely if any of the CCI is having children who is having any of these any of these problems, you need to watch closely. We need to take appropriate precautions, because this is going to cause a serious disease in the children. Okay. Now, addressing the transmission in CCI. So, CCI is again a special case. Like, it is not like a home, right? You cannot give everything, or because you cannot concentrate on one single children always. Like how we are actually doing the same in home condition. So, what we can do is we can actually limit the contact time period. So all this should happen when any of the patient or any of the person who is actually working in CCI. So this is not only for the children. Any people who are working in CCI or who are direct contact with the CCI, if any of them reported COVID-19 symptoms, then you have to ensure that in CCIs for a period of at least 2 weeks, there are the non-contact sports should be encouraged. So the contact sports and the contact arts program should be limited for at least 2 weeks, because there can be a possibility that a faster spread of the disease. And always encourage the children to report early signs and symptoms. So if you encourage the children, then only they will report some of the signs and symptoms. Because if the child is having a headache, and if the child is not telling that he or she is having a headache, we don't know. But if it is something else, if it is visible, then it is fine. If the child is having continuous cough, we can see the child is coughing, and we can take appropriate step. But it is almost always it is not like that. Sometimes some children will express different symptoms. So always encourage all children to report the signs and symptoms, and make sure that the children is not spitting or coughing and sneezing without appropriate protection. So you please ensure that in CCA all the children are not spitting simply, or they are not openly coughing or sneezing. So cough and sneeze etiquette is also important. And coming on to the mask usage, if any of the child is infected, the infected person can be given any mask. Even cloth mask will also be fine for the infected person. But all the uninfected should wear a well-fitted 3-layer surgical mask, at least during the period of quarantine, because that itself causes once a diagnosis, when the disease has been established, then the infected is no longer at a risk, but the people who are not infected is at a risk. So that's why we are giving more importance to the other children. Okay. Now, how to sneeze and cough? You can see the different steps, like how properly to cough and sneeze. If a children is wearing a mask, you can tell the children to cough or sneeze into the mask. It is okay. Otherwise, encourage using a kerchief, a cloth. And if both are not available, tell child to cough or sneeze into the elbow. Elbow should be flexed, and then they can sneeze into this elbow. So never ever allow or encourage children to sneeze or cough openly or using the bare hands. Okay, these both will cause spread of the disease. And once children coughs or sneeze, then encourage them to have to wash their hands in a proper manner. And whenever possible, try to close contact should be avoided when there is a meeting or assembly or something is going on, to make sure that the children is actually keeping adequate distance between them. And most importantly, if any of the children is sick, it is important to call for help. Okay? Now, another important thing, like how we can address the transmission in CCI. Now, according to when I spoke about mask, according to the government guideline, mask is not recommended for children who are less than 5 years, because they don't know how to wear mask properly. Even if we give them a mask, they might not be wearing it properly. So that is why. But just in case if any of the children who is less than 5 years of age is infected, then one person has to be taken care of that child. And during the contact time, like suppose if the child is taken to a hospital or something like that, during that time the caretaker should make sure that the child who is less than 5 years is wearing his or her mask appropriately. Now, try to avoid unnecessary visitors. Like if any people are actually coming for organizing some programs or something else, if possible, try to limit, because we are actually expecting a surge of cases. So at least for a few days or few weeks, you can actually limit the unnecessary visitors, and I can humbly request them to postpone their function a couple of weeks more, because we don't know, like if they are coming, means we don't know how much they have been exposed, and then if they bring the disease, it has actually been causing problems in the CCIs. And all the children who's above 15 years of age should be vaccinated. So vaccination will give protection. So now, since the government is actually running vaccination, so you can take all the children who are above 15 years of age for vaccination, and always encourage using mask in common areas. Now, how to wear mask? So when you are telling children simply to wear mask, you must teach them how to wear the mask properly, because children is not happy to wear a mask. So always they will, after some time they will not be paying much attention to wearing mask in a proper manner. So I have shown here two pictures: how properly to wear and how not to wear a mask. So let's see how not to wear a mask first. So in this picture, you can see this girl is not covered. She wears a mask, but she is not covered her nose, and she has not covered her chin. So both the chin area and the nose is actually exposed. So that is a wrong way to wear a mask. And you can see this picture. In this picture, the child wears the mask very appropriately. So you can see it is well fitted. First of all, it is well fitting. It is not loose. It is well fitting, and it is covering the nose, and it is covering the chin. Okay, so this is how everyone, all the children should wear his or her mask. Okay. Now, some important recommendations for CCI is, first recommendation is, if you can set up a COVID-19 sick room apart from the usual sick room, because sometimes if the children get injured and all, you will admit the children in the sick room, right? So apart from that, if possible, you can set up a COVID-19 sick room. Why? Because this COVID-19 sick room should have adequate ventilation. You should always open the windows and make sure that the air is actually free flowing. So adequate air ventilation should always be ensured. Now, all the children who is actually suspected to have symptoms should be isolated. So don't wait for testing. According to the new testing guideline, which is released by ICMR, what it states is, no need to test if people are actually having symptoms also. Only test for those who are having complications. Like I told, some children will be having complications like heart disease, etc. Only those who are actually need to be tested. So even the latest guidance also recommends that no need to wait the result to come to start the quarantine or isolation. So if any children is telling that I'm having cough or cold or something like that, just immediately isolate the child from the rest of the children. Okay, so this is a very, very important step, and it's a whenever you're doing that, you should always keep it in mind that isolating children is going to cause some problems for the children also, not physically but mentally. So it is always important to take care of the mental health of the children. So always when you are isolating, explain the need and purpose of isolation, and always try to provide recreational material, something like books or TVs, whatever makes the children engaged during the isolation, that need to be provided. Okay, so now moving on to the last section, that is how to conduct MSF COVID-19 telemedicine. Okay, now you all can see the toll-free number, which is mentioned here. It is 1800-309-4144. So I'll just share it in the chat also. So I'll be sharing all the materials, which is we are also developing some IEC materials along with the number and how to contact and all. So for the time being, you can note down the number. The number is 1800-309-4144. So it's a toll-free number actually. That's why it's starting from 1800. Okay. Now, according to the new government guideline also, if the children is actually showing moderate to severe symptoms, don't wait for the telemedicine. You always make sure that the children is being taken to a hospital, because this is a severe scenario. Because how we can identify moderate and severe children? If the SpO2 level is less than that of 90%, 94%, the children is in moderate condition, and if it is less than 90%, it is in the severe condition. In the moderate cases, the children need to be admitted to a hospital, but in the severe cases, the children need to be admitted into an ICU hospital. Okay, so that is a difference. And all the asymptomatic and the mild cases can be treated in isolation through teleconsultation. Okay. Now, what will happen if you call and how to make a contact to the toll-free number? Okay, so any of the children or by yourself, it's not only for children, even yourself and other workers can also make a call to the number. So any of the people who are having symptoms which is related to COVID-19 can contact this number, which is 1800-309-4144. So when the patient calls to this number, what will happen is the nurse will be attending the call. So once the nurse attended the call, the nurse will be discussing the patient's conditions, taking notes and etc. And then the call will be cut off. Okay. Now uh, after ending the particular call, within 30 minutes, a doctor will be calling you back. So in the meantime, the 30-minute time, what the nurse will do is the nurse will be consulting a doctor and discussing the case with the doctor, and the doctor will be, after identifying and understanding all the patient conditions, the doctor will be calling back to the patient. Okay. So while the doctor is calling back, the doctor will again assess the patient and all the prescription and other details and anything. If they need a laboratory advice, then that will be given. Otherwise, prescription will be given. And once that is finished, what will happen is the nurse will be following up again. So we do have a follow-up system in place. So we will follow up through till 1 week. So 7 days we'll be having a follow-up. Why we are following up is, when the call is actually happening, this is the first time the infection will be in a mild phase, but slowly day after day the infection will be getting a serious stage. So that need to be taken care, that need to be early identified. And if it is going to a moderate or severe condition, immediately we have to trigger the reference to hospital. So in order to identify it and in order to early make the shift to the hospital, we are actually doing the follow-up. Now, one important thing is, in order to protect the privacy, uh, when the nurse is actually calling, the nurse will be providing us a unique ID. So it will be better if you can note down the unique reference ID, because if you can, the next time when you are calling, because the nurse whom you are talked on to might not be receiving the call, just in case if you are making a second time call. So if you can tell the ID, it will be easy for us also to identify, the patient. If it is okay, it's an optional step. If it is not been, if it is not, you are not following up also, that is fine. We can still identify through the name and other details. Okay. Now, how our MSF telemedicine service is actually happening. So we started it during the last phase of the second wave of COVID-19 virus. That is in the last year. During September, October, we have started this teleconsultation service. So we are aiming to treat all the mild and moderate COVID-19 cases, and all the consultations are provided by certified doctors and nurses, and we will be giving routine follow-up as well as prescriptions through the services. Now, since it is a tele service, depending upon your facility, if you have a smartphone facility with you, you can do a video call. So when the doctor calls you back, you can always inform, or when you are calling the nurse will be asking you whether you have a video call facility. If you are telling you have a video call facility, the doctor will be making a call into this video call number. So the video call will be through video call, the doctor will be connecting. If you are not having video call facility, then the doctor will be calling through usual telephone. Okay. So that is with the MSF telemedicine. Now, please note that all the services which we are providing is 100% free of cost. And since it is toll-free number, you won't be losing balance also. So even if you don't have sufficient balance in your phone, you can still make a call since it is a toll-free number. Okay, and this number works 24/7. It is you can call it Sundays at late nights, etc. At any point of time, if you make a call, we will immediately be doing all the follow-ups and other things. Okay, and even if you are not able to get connected, if you are not able to speak, or if you're not able to get connected, you just give us a missed call. So we'll be calling us back. Okay, so we'll be calling you back, and that is facilities also there. And we support all the languages, all important languages, 15 plus languages we are actually being supported. So speaking in Kannada, if you are speaking in Kannada, we have a Kannada speaking doctor and nurse. If you're following up in some other language, Hindi or other language, Tamil or etc., we will be supporting the same language. So 15 plus language consultation is available, and we will be doing a follow-up. So follow-up system is placed, and uh, all the COVID related medical information, if you don't have any problem, but if you have some doubts related to COVID-19, still you can actually call the number. That is also possible through this service. Now we are actually promoting this through some digital posters and leaflets by sharing it across different meetings like this. So we have materials in Kannada as well. Now this is the last slide. So I'm just trying to give you a small activity. So when the meeting finishes, after finishing your tea and snacks, you can actually call the number. Try to call this number, the 1800-309-4144. Then tell about, just ask them, or you can ideally speak a hypothetical situation, and you're calling from CCI. So I just have some concerns regarding if any children is getting infected, what should I do? So that's why I called. You can tell that, and you can note down the feedback. You can give us the feedback and your valuable suggestions, etc. Okay, so this activity is just because to make a rapport with the number. So sometimes if you call at least once before the emergency is happening, then you will, at the time of emergency also, you will think about the number, and there you will try to make a call. So that's why I am requesting you to make a call to this number, and it's just a few minutes it will take, and it doesn't cost you money from your phone also. Everything is free of course. Okay, so that's my last slide. Thank you. And all your doubts, if you have any doubts or queries related to the presentation, or if you have any concerns, you can email it to info@pactindia.org, or you can call to Mr. Ruben Daniel. His number is 93-797-41933. Okay, thank you.
ಸೊ ಯಾರಿಗಾದ್ರೂ ಏನಾದ್ರೂ ಡೌಟ್ ಇದ್ದಂದ್ರೆ ಆ ಮೇಲ್ ಐಡಿಗೆ ನೀವು ಮೇಲ್ ಮಾಡಬಹುದು. ಇಲ್ಲಾದ್ರೆ ನಿಮ್ಮ ಇದೆಲ್ಲ ದಯವಿಟ್ಟು ಸ್ವಲ್ಪ ಗೂಗಲ್ ಫಾರ್ಮ್ ಅಲ್ಲಿ ಫಿಲ್ ಮಾಡಿ. ವಿಘ್ನೇಶ್ವರ್, ಯು ಕ್ಯಾನ್ ಜಸ್ಟ್ ಟೇಕ್ ಓವರ್, ನೋ ಪ್ರಾಬ್ಲಮ್. ಇಫ್ ದೇ ಹ್ಯಾವ್ ಎನಿ ಡೌಟ್ಸ್ ದೇ ಕ್ಯಾನ್ ಜಸ್ಟ್ ಮೇಲ್ ಇಟ್ ಅಸ್.
ಯಾರಿಗಾರು ಈ ವಿಷಯಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಾಗೆ ಏನಾದ್ರು ಡೌಟ್ಸ್ ಇದ್ರೆ ಅಥವಾ ಏನಾದ್ರು ಕನ್ಫ್ಯೂಷನ್ಸ್ ಇದ್ರೆ ಯು ಕ್ಯಾನ್ ಆಸ್ಕ್ ನೌ. ಸೊ ಚಾಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ರುಬಿನ್ ಸರ್ ನಂಬರ್ ಇದೆ, and email ID nu ಹಾಕ್ತಾರೆ. If you have any queries, you can write a mail. ಅವರು ಅದಕ್ಕೆ ರಿಪ್ಲೈ ಮಾಡ್ತಾರೆ. ಅಂಡ್ ಈ ಟೋಲ್ ಫ್ರೀ ನಂಬರ್ ನಿಮ್ಮ CCIs ಗಳಲ್ಲಿ ಕೋವಿಡ್ ರಿಲೇಟೆಡ್ ಏನೇ ಇನ್ಫಾರ್ಮೇಶನ್ ಬೇಕಾದಾಗ ಅಥವಾ ಯಾವ್ದಾದ್ರು ಪಾಸಿಟಿವ್ ಕೇಸಸ್ ಬಂದಾಗ ಪ್ಲೀಸ್ ಯೂಸ್ ದಿಸ್ ಒನ್. I think nobody has questions, it seems. So we will wind up. Okay. Okay. Thank you. Thanks a lot, Shambhu, Ramesh, sir, and Daniel sir, Ruben Daniel sir, for giving a wonderful session. And thanks a lot to ಎಲ್ಲ ಜಿಲ್ಲಾ ಮಕ್ಕಳ ರಕ್ಷಣಾ ಘಟಕಗಳು ಹಾಗೂ ನೋಂದಾಯಿತ ಮಕ್ಕಳ ಪಾಲನಾ ಸಂಸ್ಥೆಗಳ ಪ್ರತಿನಿಧಿಗಳಿಗೆ ಈ ತರಬೇತಿಗೆ ಭಾಗವಹಿಸಿದ್ದಕ್ಕಾಗಿ ಧನ್ಯವಾದಗಳು. And thanks to Mr. Harish Yogi, UNICEF, for giving technical support. And ಈ ಟ್ರೈನಿಂಗ್ ನ ಯೂಟ್ಯೂಬ್ ಲಿಂಕ್ ಕೂಡ ಚಾಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ಹಾಕಿದ್ದಾರೆ. ಸೊ ಅಲ್ಲೂ ಈ ಕಂಪ್ಲೀಟ್ ಟ್ರೈನಿಂಗ್ ನ ನೀವು ಮತ್ತೆ ನೋಡ್ಬೋದು, ಮತ್ತೆಲ್ಲ ಇನ್ಫಾರ್ಮೇಶನ್ ಮಾಡ್ತೀನಿ ನೋಡ್ಬೋದು, ಮತ್ತೆ ನಿಮ್ಮ CCS ಗಳಲ್ಲಿ ಯು ಕ್ಯಾನ್ ಶೇರ್ ದೋಸ್ ವಿಡಿಯೋಸ್. ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು, ಥ್ಯಾಂಕ್ಸ್ ಅ ಲಾಟ್. ಸರ್, ಥ್ಯಾಂಕ್ ಯು.
ಎಂಡ್ ಮಾಡ್ತೀನಿ
ಸರ್,
ವಿಘ್ನೇಶ್, ಎಂಡ್ ಮಾಡ್ತೀನಿ.
ಮಾಡಿ ನೆಕ್ಸ್ಟ್ 4:30 ಸರ್. ಹಲೋ
ಹಲೋ
ಸರ್, ನೆಕ್ಸ್ಟ್